blind in a mother's tears in the dead of night. Better than a hallelujah sometimes. We pour out our miseries, God just hears a melody. Beautiful, the mess we are, the honest cries of breaking heart. Better than a hallelujah.
Hey, Amanda, it's Angela. I'm sorry, I was in with a patient. I couldn't come out of the room.
You're fine. I just now got home, so that was perfect timing.
Good. All right. So do you want to ask questions first, or do you want me to review the results with you?
I don't have anything to ask questions of until you can review the results.
All right. Okay. So basically the results show that with triplet A's placenta, triplet A had acute chorioamnionitis, which I don't know if you've heard about that or not. They may have mentioned that in the hospital.
No, nobody's ever mentioned that. I've never heard of that.
Okay. Well, and it's not normally something that they mention, and it's rarely diagnosed any other way except on placenta pathology, which is one of the reasons why they send placenta pathologies off. The baby B had the placenta shows a decidual hemorrhage, which means there's a small hemorrhage with the placenta, which may have happened with just the delivery process. And baby C had acute chorioamnionitis as well. So chorioamnionitis means that there's basically an infection in the uterus that it can cause preterm delivery. It can cause abdominal pain. It can cause fever. It can cause premature rupture of membranes, your water breaking early. It doesn't always cause preterm delivery because sometimes when you have preterm contractions, preterm labor, and you deliver early, or your water breaks like it did with baby A, and it's broken for more than 12 hours, then it increases your risk of having chorioamnionitis because bacteria that sits in the vagina, because the vagina is not a sterile place, that bacteria can go up into the uterus and cause an infection.
Okay. How come only 2 of them had that and not all 3?
Who knows? Who knows? It's not always every multiple doesn't always have it. I'm not surprised that A had the amnionitis for sure. Who knows? Maybe on the triplet B's placenta, all they saw was hemorrhage, and it made it harder to see any inflammation because there was blood there. Maybe that was the reason why. That doesn't change, the delivery process and the premature rupture of membranes and all that. So I didn't always expect to see all 3 having the amnionitis. I was certainly expecting baby A to have it.
Okay, is that something that only happens after the rupture of membranes, or is that something that caused the membranes to rupture, or?
We will never know that. There's no specific cause. The fact that you had the short cervix ahead of time was a telltale sign that things were starting to change, which could have caused, your water to break. It could have caused the chorioamnionitis, which then caused your water to break. You can't say A caused B.
Okay, but I'm just saying, is there anything that can have indicated that so that next time if I decide to try, or is that something I should ask the doctor when I do my 6-week postpartum?
Wait, when you say indicate, are you talking about indicating the chorio or indicating the short
Indicating
term?
that this might happen again. Or should I ask the doctor that at my 6-week postpartum?
There's no guarantee that just because you have chorio this pregnancy, there's not an association that you're going to have again next pregnancy. It's not like a recurring infection. So no, this is not something to expect in your next pregnancy.
Okay, so it wasn't an infection that caused that to happen in the first place? There wasn't?
We don't know. I mean, whether it's a short cervix, which caused the rupture of membranes, and then once your water was broken, then you ended up getting infection. We don't know that.
Okay. I just didn't know if it told you anything, like if it was bad, that it would indicate that it had persisted for a while, or?
Well, one of the things that when you look at choreo, generally what happens is someone will have a really tender abdomen and a fever. You may have, trying to get back to your results to look at your labs. Why is it not pulling it up? You'll see, a fever. You'll see a high white blood count, things like that to show that you may be developing chorioamnionitis. It's still not something that the doctors, even in 2017, are 100% sure. If you have a fever and you have abdominal tenderness and your white count is going up, those are all potential signs that you've got chorioamnionitis developing. In your case, I've got you right now. Hold on, let me look at something. Yeah, in your case, on December the 3rd, you actually, one of the last white counts was normal. It was not elevated. Now, generally when you see chorioamnionitis, you're going to see like a really high white blood count. Yours was back at the end of November. Yours was a little bit high. It was 13.9. 2 months before that, it was 14.4. But you weren't having a fever and you weren't having abdominal pain. And it's not unlikely in pregnancy to have a slightly elevated white blood count. You never had like an 18 or a 20, like a scary white blood count. Does that make sense?
Okay, so is there anything that I should be concerned with of the placentas having that now that I've had the babies?
Nope.
Okay.
Not unless you're having a fever or you're having an abnormal discharge or anything like that. Are you having any of those signs?
No. But I never run a fever. I mean, every doctor has always said the same. Ear infections, nothing have I ever ran a fever with or had pain with. My mom only knew that I had ear infections because she could smell the infection. I don't run fevers or have pain with infections.
Okay. I mean, generally with choreo, we'll start seeing a rise in a temperature, but it's not, for people who come in the postpartum period, there's not something specifically that we're looking for. The cure for chorioamnionitis is generally getting delivered and being on IV antibiotics, which you were on anyway, because your water was broken.
I was not on antibiotics.
How long was your water broken?
Since Monday, and I didn't deliver until Friday.
Are you sure you weren't on antibiotics?
Yes, I am.
Okay,
I asked about antibiotics every day, and they told me I wasn't running a fever. They were not administering antibiotics.
Well, then they must be just watching temperatures at this point. Then let's see. I'm going back and see if I can see your medication list in the hospital. Let's see. Okay. Sorry, I'm looking in the computer system of the notes. I have to kind of do it one by one. Yeah, that was on November 23rd.
I'm sorry, you might hear dogs barking. I had to bring my dog outside.
Uh-oh. Okay, nothing there. Clinical note. Resident. Okay, you were 3 centimeters there. All right, so here's the problem I run into. There's a whole separate way to get into like the nurses' vital signs, and I don't have access to that. The doctors have access to that since they see the patients in the hospital. So I was trying to look for a chart of like temperatures. I don't have access to it.
Okay.
got the labs, and I've got the notes, and the notes that we're able to see are not, they're not the nurse's notes. So the doctors can pull that up, though. Well, it says actually on November 29th, afebrile, so I guess the resident was documenting no temperature at that point. Well, I take that back. She actually did type in there. It was 98.4. So no temp there. So, maybe, and this is where the difference comes in with me seeing patients on an outpatient basis versus inpatient. Maybe they have changed their plan. Maybe they don't always give antibiotics with with that anymore. I guess it just depends on.
I always thought it was because my niece just gave birth a year ago, and as soon as her water broke, that was the first thing they did was give her antibiotics.
Well,
I thought that was just standard of care. I mean,
I don't know that.
Me neither. I mean, I asked about it when the water broke because, like I said, every birth I've ever been in, I watched all 4 of my nieces and nephews be born, and except for the twins because they were C-section, and my great niece, and that was always the first thing they did.
Well, part of that depends on like a group beta strep infection. There's certain things that they swab for that I wouldn't know that without seeing records for them. Maybe they wait for that. So the several temps I've seen that the residents have documented, your temp has stayed between 98.2 and 98.4.
Yeah, and like I said, I don't run a fever when I have an infection.
Plus they look at the white blood count as well. And see this real quick. Looking for one more thing here. Okay, there's that. Sorry, you're having to listen to me. Okay, so it looks like that on December the 3rd, your white count was it was normal. It was not low and it wasn't high. It was completely normal. The day before that, the day before that it was 14 on December 2nd, and on December 3rd it was 11. So, I don't think that tells us a whole lot of anything. I don't have access to like the IV antibiotics, so that the nurses chart, so I can't find that. The only thing I can see is like postpartum medications, and that's it. Either way,
the iron that they sent me home with they sent me home with the iron, Colace, and ibuprofen. Is that what you're talking about?
Those medicines, yeah, the iron, the Colace, I think the Pepcid. Maybe some of these are just medications that they put on there that maybe you came into the hospital on too. The insulin, the metformin, things like that.
Okay.
Those are what's listed for me to see. So going back to whenever you're going to be seen and given your history and all, obviously, the question is, was it incompetent cervix, which most likely it was, but which is not uncommon with a triplet pregnancy. Could it have been some preterm labor? Maybe after a week or so. But, definitely letting them know that there was chorioamnionitis. I don't think any doctor is going to be surprised when they hear that you had a short cervix and then your water broke with baby A. It's just kind of the expected course. Does that make sense?
Okay, so what would the course of action be if I was to try again, knowing this history?
Like I said before, and you, I think I made you angry, and I certainly didn't mean to be, and I know this is not in your control, but, multiples are super high risk. There's lots of potential of things to happen, especially with higher order multiples, triplets and quads. There's a lot of things that just are out of control at, at that point. So having a singleton pregnancy would be more ideal than anything. And, that would be between whoever you see reproductively. Just asking them, what can I do to help control this next pregnancy? But avoiding a multiple pregnancy would probably be my best suggestion.
Well, like you said, I mean, that's out of anybody's control. I don't do IVF. It's not like I'm saying plant 3 in there and make sure I have 3.
But they can do IVF to avoid this issue too. Help avoid it. If they place 1, then, there is a remote chance that it would split to give you twins, but not 3 and 4 babies.
Okay, but what would your all's course of action be in the chance that it was multiples again? Would you guys check it more, or?
The exact same protocol that we were doing this time, except we would look at your cervix maybe at 13 weeks versus 15 to 16 weeks.
Okay.
And then we would do. Mm-hmm.
So go ahead. I'm sorry. I didn't mean to interrupt.
No, then we would do the protocol that you were on with cervical links anyway, although you didn't get far into it, is the same protocol we would do. We just might do one earlier cervical length on you.
Okay, and what about knowing that the babies had the chorioamnionitis? Would you guys check for infection more often, or?
You can't, other than watching for a fever, which you say you wouldn't have, doing periodic complete blood counts, you could do that, which we would do on any patient anyway. That's not, we wouldn't increase the number of those. We wouldn't do anything different.
Okay.
But because just having this with this triplet pregnancy does not increase your risk for having it with another pregnancy.
Okay.
Does that make sense?
Yeah, and if I have, like I said, if I have any other questions, I'll ask at the 6-week postpartum checkup.
Okay. All right, so you don't have an appointment scheduled then. So I don't think. Let me see. Let me look down let me change the month here so I can see maybe when. Do you want to ask Dr. Reddick any questions? I was going to see when she was seeing patients.
No, I think you've answered them all.
Okay. So who are you going to see for your 6-week postpartum? Did you have someone in mind, or how do you want to do that?
Am I supposed to have a 6-week postpartum? I've never delivered before.
Right. Well, I didn't know if you had already scheduled to see someone else or something. I didn't know if there was something set up when you say your 6-week postpartum.
No, I didn't know if, I thought everybody did a 6-week postpartum.
No, well, it depends on when it is that you deliver and all that. So not necessarily, but I certainly can get you on the schedule for one.
Okay. If I don't need one, will Dr. Reddick answer my questions if I think of any questions that I have, or maybe you, if I call back in?
Yeah. Oh, yeah. Sure. That's not a problem. I can't, for some reason, get in her schedule to keep going to see what day she's on. If you were going to come in, what day she could answer your question.
If you guys don't think I need a 6-week postpartum.
Dr. Reddick did not think that you need any more visits.
Okay.
When I asked her about it the last time, just because I knew how upset you were, and I didn't know that if it was part of that was just coming into our office or not. She said that technically you don't need any more visits. But if you have any questions, if you want to call me back, and then I can see if she's around and get her to talk to you as well, that's totally fine.
Okay. I appreciate it.
Okay, Amanda. Good luck with everything, and I'm hoping for good things for you in the future, okay?
All right. Thank you.
Okay. Bye-bye.
Bye-bye.